Mentally and emotionally, the pandemic has taken a toll on frontline staff in Indianapolis COVID ICUs. As the war against the virus continues, the importance of mental health only deepens. WRTV's Nikki Dementri shares that story tonight.
I can't tell you how many times I'm talking and the tears appear in my eyes.
Monica Hammerly says it's the support and strength amongst family and coworkers that gets her through the tough days.
My husband has said, a while back, he said, "You do have PTSD." And I agree. We all are sharing this burden of seeing people died.
Hammerly recalls her first COVID ICU patient on March 23rd, a face she still remembers, alongside so many others as she continues to work in IU Health's COVID ICUs. She says herself and others have sought professional mental health help.
I have no doubt that there are some faces that we'll never forget. So I know that this is going to be part of us.
It's the same feeling at Franciscan Health.
That's been a tough year. It's been a very, very tough year.
Stress, anxiety, and fear, just three of the countless emotions Dr. Ahmad Shahwa says he sees in his COVID ICU. It's the mental anguish from seeing friends and colleagues fighting for their lives to the worries of bringing the virus home.
We've had many of our providers going home and saying, you know what, I really did not want to come back. We've had quite a few of our nursing staff basically quitting and saying, I cannot do this.
A recent study published in a UK peer-reviewed journal found data to support how these two frontline workers are feeling.
I've seen it with my own eyes, like some of our providers crying in the ICU.
PTSD, anxiety, depression, and drinking problems were some of the issues reported. The study also found around 1 in 7 face self-harm thoughts.
We are at a crisis and tipping point with supporting our healthcare providers from a mental health standpoint.
IU Health's Dr. Jennifer Hartwell says surveys done within the hospitals helped create targeted interventions like embedding therapists in teams. She says local data details 40 to 60% of IU providers say they experienced distress or anxiety, and upwards of 80% had safety concerns.
It certainly taxed on their reserves more than I think ever before. Moral distress, compassion fatigue, burnout, those are things that we're commonly speaking to.
Erica Green with Franciscan Health manages the Internal Employee Assistance Program. She says virtual help and having therapists round with the units are just some of the help for Franciscan employees. Nikki Dementri, WRTV.
As the pandemic continues, all frontline healthcare workers are encouraged to reach out and seek help. Both the doctor and nurse we spoke with for this story shared with WRTV the hope they say comes with the vaccine rollout. They urge Hoosiers to get the vaccine when it is made available. And until then, keep masking up, social distancing, and the like. We have more mental health outreach resources on our website at WRTV.com and the WRTV app.